How healthy do I have to be? Or another question, what would disqualify me from buying a policy? Are there particular ailments, medical conditions, high blood pressure, whatever?
So generally, I would say the most, highest reason for getting declined is probably that you're a little bit too short for your weight.
Nicely put.
We see a lot of that.
But something like high blood pressure would not automatically
No, most people, and in fact, again, through the evolution of this product, there was a point in time where people that weren't on medications were, the preferred risk, and people that were on medications were the not as preferred risk. What we have found out over time is that people who are going to see their doctor and know what's wrong with them and are on the right kinds of meds are a much better risk for us than those people who have not seen a physician and therefore are a bit of an unknown in terms of what's going on with them.
So I read somewhere, and you can tell me whether this is true, that I think it's 20% is about the percentage of applicants who are denied because of health reasons?
That's correct.
Okay.
About 20%. And that number, ironically, has stayed the same for my entire career, which just tells me that agents do a great job of pre-screening and understanding the underwriting manual.
I want to make sure I understand the combination. Let's say it's $500,000. So if I use $300,000 in long-term care, I still have a $200,000 life insurance policy. Is that the way it works?
Yes. So it's a little bit more complicated than that. You can have your life insurance policy, your face amount for your life insurance policy, and then most people buy a rider that extends that's just for long-term care. And most of these products then have, even if you've already used your entire life insurance face amount, there's a residual death benefit that's payable as well. So nothing simple in the insurance world, right?
Are there any something brand new that's going to come up in the next year or 2 or 5 years that this audience will be interested in?
That will take the market by storm?
Yes, that will send it zooming from 5% to 20 or 30%.
I'm going to let Warren take that because he sees all kinds of things from other insurance companies.
I'm seeing increased interest in combination products, either with life insurance or with annuities. The very first generations of these were single premium, and now you see annual premium or limited pay, but something longer than single pay. And I really do feel like for people who are concerned that, well, if I buy this long-term care policy and I don't have a need, then I've spent all this money and nothing became of it. Well, to some degree, a combination product takes care of that. You will ultimately use that death benefit.
Yeah, I think that definitely combination products really are outselling the standalone product. I think we're in a little bit of transition now around the types of benefits that are being sold. Previously, we were selling a lot of lifetime benefits and very high dollar benefits. I think the reality is that we're seeing that most people don't need a policy that's that large, so smaller policies are becoming more popular, and I think as people understand that and they become more transactional in nature, I think that we'll see some products that are available direct to consumer without an agent that will be interesting, because in my experience, if somebody is interested in talking to you about long-term care insurance, they're halfway to sold or more than halfway to sold. So waiting for somebody to raise their hand is the issue. If we can make this simple enough so that we can sell it more directly to consumers and make them aware that there's something out there that is affordable and easy for them to understand, then I think that we've got something that we can work with. Part of our challenge is that, the rules that surround long-term care insurance around disclosure and the application process were built for when we were selling to, quote, senior citizens. And now that we're selling to people that are in their 50s, we still have to get the same number of disclosures, all of the same paperwork filled out, and yet, these are people that are still in their working years, and probably all of that disclosure is not as valuable to them as it may have been for a senior citizen. So if we can find ways to simplify the process, then I think that we can come forward with a lot more solutions and reach a lot more people.
Here's something I'd like to
I was going to add something, which is, I think for if you're watching the insurance industry, what Beth is saying is very important. There's obviously a huge room for growth. But if you are sitting in state government and you're worried about sort of what's happening with long-term care writ large, I mean, the best estimates I've heard is even if you increase subsidies and you increase all sorts of federal policies that's going to increase demand and make supply easier, maybe you'll get it up to from 10% of the population to 20%, 25%. And that really sort of the large question of how the majority of people are going to finance their long-term care is going to be somewhere else. And that's sort of the big question that people are also grappling with. I mean, there was a recent study that came out from the General Accountability Office just last month, very conveniently, that showed over half of the people over the age of 55 have no retirement savings. And among those people who have no retirement savings, about a third, and those retirement savings in a formal tax sheltered kind of plan, and among those half that don't have retirement savings, about a third also have no personal savings of any significance. That a majority of them cannot handle more than a $400 unexpected expenditure. So I think there's a large group of people for whom long-term care insurance will provide a very important set of asset protections and a way to finance long-term care. But for the vast majority of people, considering we're talking about a group of future seniors who are really woefully underprepared for retirement, the question is sort of what else is out there, because they've got some real issues in terms of being able to finance these kinds of products.
Well, following up on that, let me pose this question to all three of you. If this huge number of people don't have $400, they don't need to worry about long-term care insurance. If they go into a nursing home, they'll go on Medicaid. I mean, that's taken care of. If you're very rich and a multimillionaire, you can pay the $100,000 or $200,000. So give me an income level or an asset level where people should be buying it. When you have X dollars, you should probably buy a long-term care insurance. Each of you want to give me a number? Take a guess at a number? Beth?
I knew you were going to call on me.
Just calling on you first.
Yes.
Okay.
And we've been, of course, internally all over this as well. I mean, we are looking at people right now in that $75,000, cohort, $75,000 annual income cohort, which, is the fringe, in my opinion, of middle class. And that's where we would like to see the product move to.
$75,000 and up, right?
$75,000 and up.
Right.
Yeah. We could possibly go lower, but, again, it's a chicken and egg type of thing where, with the way that we are required to structure the product with combining, certain inflation options and things like that, we can't make that product inexpensive enough to get to a lower socioeconomic level. So if we had some relief in terms of changes in regulation where we could feasibly make the product a little bit less costly, then, we may be able to go lower. I mean, to Lee's point, it's difficult to envision a scenario where we could sell to somebody who doesn't have $400 in disposable income.
Well, so
So we got 75,000.
Yeah, and I'm not sure what
How
the number
much
is.
assets?
I'm not sure what the number is, and I'm not sure what, and it's both
It's
an income and an asset
Right.
question,
Yes.
too. But the $400 was a question of not how much disposable income. I mean, this could be people who have significantly higher incomes, but they are just very leveraged, and things
Sure.
are very tight.
Sure.
So they don't, they may
Well,
not have the
they still-
disposable income, but
That
they,
would still mean that if, to
Right.
your point, they don't have, if somebody said, hey, you need to pay me $400 right now.
Right,
They
right.
can't do it.
right. So, I mean, I think you could have people at actually fairly high income levels.
Oh, sure.
Who are so leveraged that they can't afford.
Sure.
They don't have the discretionary income. I have no idea what the, what the level would be. My guess is it would probably be higher, though. Just because if the median income is 40, 50, what percentile do you think 75,000 is at, is the question?
We kind of look at that as like I said, kind of that fringe of the middle.
Yeah,
Yeah.
I don't know.
Warren, have you got a number? In other words, if
Well,
I have 200,000 in savings, my life savings, I want my kids to get that, should I buy a long-term care?
And that's
insurance? Should
that's
give me a higher
exactly what I was
number,
going to
lower
talk
number?
about.
Okay, go ahead.
And I wasn't going to throw out a number,
All right.
but just a concept. So Beth was talking about the lower end being somewhere around 75.
But wait, that's income, that's not
Right,
assets.
that's
income.
lower end of income.
Right.
Well, there's the higher end of mass affluent where you could look at long-term care as asset protection and just saying, okay, I want to protect this much of my assets from my long-term care need. This together with other funds I have will cover my long-term care need, but it'll mean that at least this much I will be able to pass to my heirs. And so the people at the upper end of the mass affluent may look at it that way, not that they actually need these funds in order to pay for their long-term care services and supports.
So one of the questions I had written down was how are consumers attempting to solve the issue of long-term care today? But I guess your answer was they're not. They're not thinking about it.
Oh, no, I think
Or are they?
around non-insurance ways that they're trying to solve for it. There's some very interesting things going on that consumers are doing. I think most people are aware of, the Beacon Hill Village and, some of the community banding together almost in a communal sort of way, creating an association, if you will, that people pay to be members of. And it's not just limited to long-term care. It's limited to the very broad situation of it can be anything from a referral service type of thing for repair people all the way to a long-term care situation. So I think there's more and more of that. There's actually the Village to Village network that is a formalized association. You can go on their website. You can apply to become a member of the association, and they will provide support, tell you how to get people in your community interested in this effort. And, in most communities right now, it's more on the affluent side that this is happening. But it's a social thing, and it's, for the most part, it makes a lot of sense. If you didn't invest in a long-term care insurance policy, and you want to age in place, which is, that's the driver, right, is that people want to stay in their own home. And so that's key. So if I can stay in my own home and just pay to a community association that's going to advise me about who I should go to if I need some help with, not necessarily ADLs, but just instrumental ADLs, things like transportation, things like grocery shopping. That's how it starts. And then it moves into the inability to care for oneself. So, I think that makes a lot of sense.
It's interesting in this GAO report, there was a figure that 65% of people who are 40 and over have done nothing to plan for long-term care. So my guess is that as a population, as a country, we're going to kind of muddle along for a while. But I actually think the real driver may be something different, which is states having to deal with their Medicaid costs. That is increasingly becoming a budget problem for states. And if you look at some of the modeling that's been done, and there's some actually interesting things about to happen in this area, while the Class Act was a flawed program, it really wasn't constructed right. The only way you are going to get any kind of significant Medicaid savings at the state level is if there is some sort of universal program that people have to participate in, and that's national. And that will create significant Medicaid savings. And that may be, in the end of the day, regardless of how you view health care and regardless of how you view the role of government, if you're a policymaker and you're at the state level and you're worried about education budgets and transportation and roads and things like that, you got to be worried about how can you find more budget money for those things.
Is there any sign on the national level that anyone's talking about this to sort of relieve the threat to the state budgets?
No. There is. No, it's interesting because there's a whole group of people who are starting to talk about this now at the national level, and there's some very interesting modeling being done at the Urban Institute that I think actually will shed some light on this, sort of late this year. And we'll see what that says. The National Academy has been part of a group that's been talking about this with the folks who are doing the modeling. But I'd say at the national level, there seems to be a coalescing around the idea of some kind of public program that will be for catastrophic care, and that will allow insurers to have more certainty about what their exposure is, and that is something that may appeal to consumers. I think there's still a lot of divisiveness over mandatory, voluntary, and there's also a lot of concern that, frankly, a catastrophic program will really by definition, help a small percentage of the population. And, so we'll see where that goes. But it is interesting that there is at least, I think, a constructive atmosphere of wanting to tackle something, and that's where people are at least starting with some possible agreement.
But I take it, though, none of the presidential candidates from either party haven't heard a whisper about that.
Yeah, it's interesting because, there's so many governors running, right? You think they would be saying this is a real problem that states have to solve in terms of Medicaid because they've had that experience with their Medicaid budgets, but they're not. We were talking about this at lunch. I think 8 years ago, Hillary Clinton said in one speech, mentioned long-term care, and all the long-term care policy people were abuzz because it was the first time a presidential candidate had mentioned it in, I think, forever. And that quickly kind of went quiet. It doesn't seem to be a political winner yet for candidates to plant a flag and try and stake out a policy in that area. And I think when voters will reward candidates, then they will.
Well, let me ask Warren, suppose some of the would-be presidents call you confidentially and say, okay, Warren, I want to do something with this. What would you then suggest to them as key policy ideas in developing a workable long-term care program? Now, this is obviously only going to be within this room. We're all going to keep this confidential because it's secret. So, future president calls on you and says, okay, what do you think? What should I do? Secretary Warren.
Okay, here's my top 5. Is the program going to be voluntary or mandatory? That's a big issue, and that goes to anti-selection. We saw with class that the combination of all the provisions resulted in some significant anti-selection. Second, will it be social insurance, private insurance, or some hybrid of those two? That last one would be a very interesting thing to consider. The third, is it pre-funded? Meaning, do the people who receive benefits, have they already paid the premiums for the benefits they receive, or are the current claimants going to be being paid for by current enrollees as a pay-as-you-go? Then benefit design features, is it going to be a cash benefit program like we saw in class, or a reimbursement program where people actually submit incurred expenses and are reimbursed for those claims? Will the program have an elimination period during which no benefit is accrued, Now, I'll distinguish that from the waiting period that we saw in class. A waiting period starts with your enrollment date, and it says, okay, for this period of time, you're not eligible for benefits. An elimination period starts with your claim date, and it says, okay, for this period from the start of your claim, you're not going to accrue benefits. And what that does is it eliminates the short benefits, and it also creates co-insurance for the claims that last longer than the elimination period. Another benefit feature is, will there be a benefit period something less than lifetime? So the shorter the benefit period, the more affordable it becomes. But that becomes a balancing act between the comprehensiveness of the benefits and affordability. But if you make it more affordable, you could get higher participation in a voluntary program. Number 5 would be claim eligibility. I think we've all gotten fairly comfortable with ADLs and severe cognitive impairment as a trigger for long-term services and supports. But I'm just saying that would be a question I would raise.
Okay, Lee.
Yeah, so actually there's a very simple answer if we could get over the politics of it all, which is there's literally, I think, in about half a dozen pages, you could actually tweak Medicare to include a significant amount of long-term care. There's restrictions on home health. You could change that very easily. There's restrictions on nursing home stays. You could change that very easily. Medicare has the brand name popularity. It has the universal participation. It's a natural vehicle, frankly. The only question is, how would you do? And I mean, the criteria you raised, Warren, are exactly the criteria that policymakers have to go through, and I think you'd have to do that with all of this. But the only question is, how would you do home and community-based services? Because the feds are just not good at that. Particularly, they don't have any experience with that. The states do through the Medicaid program. So maybe you let the states do it and the feds reimburse them or something. You could do some sort of federal-state partnership. And then the kicker is, we've got to do something to address Medicare solvency anyway. And if you're going to make people swallow a bitter pill of perhaps a higher Medicare tax, put something in it that's sweet. That'll also give them an extra benefit. So you could address Medicare solvency over the long term at the same time. But this is all kind of a secret, so don't tell anybody.
Okay, Beth, now it's your turn. You're sitting down with the would-be president saying,
Yes.
okay, I'm going to put in my campaign whatever you tell me to do. So what's your solution?
My solution, well, ironically, I agree with Lee. And actually, I would have endorsed the Class Act, but I'm not an actuary, Warren is, so he wouldn't let me do that. I think any time, as I said earlier, any time that the government is putting out a program that talks about long-term care, the private long-term care industry has seen an uptick. If it were added to Medicare, then we would create Medicare supplements that would fill in the gaps, or we would create, Medicare LTC Advantage, like a Med Advantage program. There's a zillion different ways that we could go, but we are hamstrung, again, by current regulation that wouldn't let us do that. I wanted to go back just a little bit, too, on the topic of politicians and what they're talking about around long-term care. I wanted to point out and bring to everyone's attention that there is a new caucus in Congress around caregivers. And it's primarily, as you would imagine, it is the female members of Congress that have coalesced around this topic, mainly because they have been caregivers themselves. And so the ACT caucus, as it's called, is endeavoring to create an environment that recognizes caregivers and has just promulgated their first piece of legislation, and it's innovative. And the reason that I bring it to your attention is that I think there is so much that we can do in this space. Their idea is to create a youth corps of caregivers, similar to the Peace Corps or something like that, where disadvantaged youth are brought into the caregiver training ranks, given the necessary support, make a 2-year commitment to be caregivers for older adults, and then after that 2 years, they're given educational benefits. And if they choose to use their educational benefit to go into health care, they get even a larger educational benefits. Now, there's, of course, the devil is in the details around any program of this nature, but I like it because it's innovative, it's thinking outside of the box, it's solving an issue that we haven't even touched on, and that is we have an issue with the cost of long-term care, the cost of long-term care insurance, the planning for long-term care. We haven't even talked about the issue of an adequate, reliable, well-trained cohort of caregivers to even supply the services. And that's critical. So it's the perfect storm, this long-term care issue. It's got everything going on. And there are ways to solve it. I think this, proposal, whether it actually gets approved or not, remains to be seen. But if caregiving has gotten to the level of becoming a caucus in Congress, that should be a message to everybody in the country that we need to be paying more attention to long-term care issues.
It's very significant, and I take it this is a bipartisan.
It is bipartisan.
Something
absolutely.
you never hear these days. Both Republicans and Democrats are working together on this.
Yes.
Very interesting.
Yes.
Well, the panel's done a great job, and now it's time for you to step to the microphone.